Hi, everyone. This is Dr. Mary with 4 Points Family Chiropractic. Thanks for tuning in today for our little segment here on metabolic health. It's something that gets discussed a lot in our office with our patients, so I just wanted to make sure that we had some kind of basic understandings of it for everybody. If you have any questions, please make sure that you leave them in a comment below. It's going to go up on our YouTube channel, so you can leave comments there as well. We're happy to answer questions. For those of you that don't know us, we are located in Northwest Austin, Texas, and we get to take care of a lot of people in that community. And again, this is just something that we've seen come up in discussion is metabolic health, what it means, how we can help control it, what we can do to help it. When I'm saying metabolic health, what I really mean is how your body is taking fuel and utilizing it appropriately. So the fuel is glucose. All food, it gets broken down into glucose, goes into the bloodstream, and then gets utilized specifically by the body to do all of the processes that keep us alive and healthy and functioning. And it's our preferred source of energy. That's what our body likes to use, but we overdo it. Americans in particular, but generally humans just overdo glucose consumption at this point. We actually consume almost 100 times more glucose than our ancestors did a century ago. So it's a big change. It happened in a short period of time. Human beings did not evolve over 100 years suddenly to need more glucose. You actually really only need about 70 to 80 grams of glucose daily, but we typically consume more like 300 grams a day. So that's a huge disparity. That's a huge difference, and our body needs to figure out what to do with that. So the glucose gets into each individual cell to be used as fuel through something called insulin. So when you eat food, it goes through your gut, goes into your bloodstream, your liver, your bloodstream, gets broken down, turned into glucose, and that tells your pancreas, okay, release insulin. Insulin is a hormone. Think of it like a key. So the insulin goes to each cell in your body, no matter where it is, turns a little lock, the doors open, glucose goes in and gets used by the powerhouse of the cell, the mitochondria, to do whatever it is the cell needs to do. That happens regardless of where it is in the body. Now, if you have too much glucose, it hangs out in the blood, and that's super inflammatory. Glucose is actually pretty toxic to us when it's in high amounts like that. So your body adapts. Once the glucose has gone to where it's supposed to go, if there's still a lot in the blood, then it gets stored in the muscles. It's glycogen, excuse me. Once it's stored there, it's so that we can use it for our muscles. But again, most people are sedentary much more than they used to be now, right? So we're not using our muscles, even just existing, as much as we did previously. Okay, so those are the stages, right? Goes into the cells where it's needed, goes into the muscles as glycogen. Then what? What if it's left over? So that's when it starts to go into adipose tissue. It forms fat. Now, at this point, your body's using it to just store for emergencies, but what really emergencies do we have where we need that much adipose at this point, right? So that's what ends up happening to the glucose when it's over a certain threshold. Now, when there's high levels of sugar in the blood over time, your body starts to get used to it, and it doesn't send the signals to create insulin quite as much. And when it does, it needs more insulin to get the cells to open up for the energy to go into the body. So what I'm describing there is called insulin resistance. So that's a very early disease process. Insulin resistance is a little bit tricky to catch. But if left untreated, undone, if you just ignore it and you don't know, insulin resistance ends up becoming a disease process called diabetes mellitus, type 2 diabetes. So it's a lifestyle disease. It's something that we give to ourselves either without realizing it or really subtly over time. Now, insulin resistance can also end up causing Alzheimer's disease. Alzheimer's, you'll hear referred to now sometimes as diabetes type 3. It's insulin resistance specifically in the brain. So the glucose is having trouble getting to where it needs to go in the brain. So these are two really big metabolic diseases. The other one that you'll hear referenced a lot is cardiac disease. The reason is when your blood sugar goes up like that, it's inflammatory to your entire body, and that includes your blood vessels. So when your blood vessels get inflamed, it'll cause kind of widespread cardiovascular disease, and that ends up increasing blood pressure. Your heart works harder than it needs to. Add to that, we're not getting the cardio exercise we usually do because, again, we're sedentary. So you can see how these things kind of snowball. Now, poor metabolic health on a more subtle level can impact things like your fertility. It can make your risk for stroke higher, cancer. Cancer cells love glucose, they feed on it. So these disease processes are ones that we can catch kind of as we're doing screenings, but the kind of subtle signs of it are things like fatigue, brain fog, anxiety, depression, chronic pain that you can't get under control, low endocrine function, bad endurance, you can't make it as long as you used to doing activities that you used to, appetite swings. But these, you can tell why a chiropractor kind of cares about these, right? So many of these clinical presentations are also neurological presentations, and we see a lot of overlap here with our patients. So when we are asking you questions about diet, lifestyle, how you're feeling, a lot of what we're doing is kind of integrating this into your treatment with us. We want to make sure that we're covering all of our bases with you because we have to discern where the issue is. And often patients have multifocal problems. We're kind of dealing with more than one thing at one time. So if these are symptoms that are familiar to you or to somebody you know, and you want to get them checked out neurologically as well, please let them know about us or any chiropractic office. If they're in the Austin, Texas area, they can call us at 512-345-9355. They can come in to our office and get a full neurological exam, any necessary x-rays, orthopedic testing, and a full review of findings. It's normally $348, but if they mention this talk, if they say insulin, then they can get it for $97 plus a pillow to support the cervical curve and the neck while they sleep, because often people with metabolic health issues don't sleep. They have a really hard time either getting into deep sleep, staying there, or they have that kind of crash in the afternoon, nap, maybe they're exhausted later. And it's just one of those things that we'll see pop up. Now, just so you know how widespread of an issue this is, 88% of adults in America are not metabolically healthy. And so that kind of comes back into the subtlety of it, right? You might think you are, but you might not actually be metabolically healthy. So how do you actually know? There are 5 factors that you need to be able to meet. So to be metabolically healthy, your blood pressure has to be normal. Your normal fasting glucose has to be normal. Your normal fasting triglycerides, your high density cholesterol, your HDL, and your waist circumference needs to be a particular range. All of those 5 things need to be met without medication. So you might be hearing that and thinking, my blood work is spotless, but you've been on blood pressure medication, even a low dose, for a few years. You're not technically metabolically healthy. So you have to meet all 5 of those things without any sort of pharmaceutical intervention. Now, often when you get the blood work, some of those are in it standard, like the triglycerides are almost always going to be, the HDL, the fasting glucose usually is as well. The waist circumference and the blood pressure, things are monitored separately. I really like when we're talking about metabolic health to be getting a more full picture of what their body's doing with fuel and glucose. So when I read blood panels, I really like to get, of course, the A1C, right? That's becoming more standard. The hemoglobin A1C is letting you know where your risk for diabetes is. And what it's doing is it's tracing your ability to utilize glucose in your blood for 3 months. So it's kind of a long-term picture. And then fasting blood glucose is like that moment in time, how's your body utilizing sugar. I also like to order a test called glycated serum protein. So what that's doing is it's measuring the level of your blood sugar for the past 2 to 3 weeks. So it's kind of filling that gap in between A1C and blood glucose. And it's just a good way to make sure you're getting a full picture. You can also test the beta cell function of your pancreas as well, really directly, just by testing your insulin levels. So that's another test I do like to run for patients that are having any sort of these kind of subtle presentations. They want to make sure they're utilizing their glucose well. Another really worthwhile test to consider is checking out your gut health and your inflammatory pathways. So again, a lot of this glucose misuse, your body not being metabolically healthy, will present in other systems of your body. So making sure you're getting a good idea of where you are there is very, very helpful. We test gut health as well. And it's just making sure that your whole health is covered, which is what we're all about. At our office, we want to make sure our patients are reaching all the milestones and their goals that they want without any risk of health implications down the road. And metabolic health is truly one of those things that you have to invest in early to reap the benefits of later. So as you get older, your body has a harder time maintaining metabolic neutrality because our lean tissue levels drop so much. And I'll talk more about that in just a second. I'm also seeing more people are having access to continuous glucose monitoring. You'll see them, people have them on the back of their arm there. Some insurance will cover them. Some of them are cash. You can just kind of voluntarily get them on your own. It's a really cool way to see what certain foods do to your glucose levels. That's important if you're somebody who's doing, for example, intermittent fasting, and you want to see if you can have black coffee during your fast. If you have a CGM on you and you have black coffee, you can actually watch on your app on your phone and see if your blood sugar spikes. And if it doesn't, you know that you're fine with black coffee. You can see how big the spikes are. It's just a really helpful tool that I'm happy to see is becoming more available to people. But once you and your doctor have determined that you have metabolic health concerns, you need to figure out what needs attention and how to do it. So I'm going to give you 2 tips that are just really, really easy. I kind of recommend everybody start thinking about them. So the easiest thing to do is control your muscle mass and your blood sugar. So avoiding glucose spikes is going to be probably the most important thing, and that's comes down to what you eat, what you consume, what you choose to eat. You want to avoid sugar, processed foods as much as you can, hydrogenated oils. All of those things will spike your blood pressure. Stick to whole foods as much as you can and make sure that you're cooking them appropriately, not with a ton of oil, things like that. But the biggest macronutrient I want to talk to you about in regards to metabolic health is actually your protein levels. So most people aren't getting enough protein. Women in particular have a hard time getting enough protein, and your body is going to be utilizing that for fuel and for muscle growth, which helps your blood glucose levels. So remember, you only need about 70 to 80 grams of blood glucose a day, but you can only utilize about 35 to 40 grams of that every meal. So make sure you are dividing your glucose levels up during the day as much as you can. Again, if you're doing IF, that's easy. That breaks down to 2 meals. Just make sure that you're kind of doing that the beginning and the end so that it's more continuous level. But we want to make sure that you are supporting your lean tissue, so your muscles. So if you're storing your glucose in the muscles and in the fat, it's getting packed away, right? You're storing it, so you, by definition, you cannot burn it. So if you're storing it, you can't burn it. We want to be burning it. To burn it, you need lean tissue. You need more muscle to do that. To do that, you have to build lean tissue with more protein. Sorry, that's what you need. That's the building block. The amino acids go into the muscle building. So you want to first make sure you're consuming adequate amounts of protein. Try to build your meals around your protein. Like, make that the first thing you think about, the first thing that goes on your plate, and then build your carbohydrates and your fat around your activity level. If you're a high cardio person, do more carbohydrates. If you're lower, just really focus on your protein and making sure you get enough fiber when you do get your carbohydrates. Shoot for anywhere from 1.5 grams to 2 grams of protein per kilogram of body weight. That's an easy way to do the math to figure out how much you need. I think you'll be surprised. It's more than you're really probably taking in every day. Just try to start building up to those levels and you'll notice a difference with your energy. Timing matters as well. You want to start your day with protein or start your first meal with protein. Shoot for anywhere from 30 to 50 grams of protein on that first plate of the day. Again, this is, if you're doing IF, it won't necessarily be breakfast, right? It's just going to be like the first meal that you consume. But 30 to 50 grams is a good golden rule to have on your plate to consume your first meal of the day. And there's a bunch of different ways to do that, but that's a good number to be focusing on. Try to resistance train at least 3 times a week, more if you can, but 45 minutes 3 times a week of resistance training will help you build lean tissue and you will see changes in your metabolic health within about a month. It's a really, really easy way to get your metabolism working the way that it's meant to. So that's just a good way to get more metabolically healthy. These actions have, again, really huge repercussions moving forward. Fun fact to kind of know about yourself as far as what effort to put in now. Human beings, once we reach about 40 or 50, every decade we age, we lose 8% of our lean body tissue, whether we want to or not. So making sure you're putting on the lean tissue, growing muscle now, and as you age is going to be really, really helpful for bone health, spinal health, nervous system health, and metabolic health. So it's really one of those things that you put an investment in now and you see a trickle down the line. And that's, if you've been in our office, you know we talk a lot about that. The resistance training obviously depends on a healthy nervous system, a healthy spine. We don't want any risk of injury. So if you're somebody who wants to get assessed, or you know someone that needs to get assessed to make sure they're not going to harm themselves doing it, they need more specific exercises kind of tailored to them and their spine. Let them know about our office. If they call at 512-345-9355, they can come in and get a full exam, neurological testing, orthopedic testing, full spine x-rays, anything they need for us to determine what's going on, and a review of findings. It's normally $348, but if they call and they say insulin, they mention this Facebook Live, they can get it for $97 and a pillow to support their sleep. So again, if you have any questions, please drop them for us in the comments below. And if we can be of any help to you in the future, definitely let us know. Thank you for tuning in, and I hope everybody has a happy summer.